This program, while curated to help you improve your health, contains general advice and should not replace the individual advice of your medical practitioner.
So what did you discover once you started studying that side of medicine?
I realized how deficient we are in our medical training. I think that was the most shocking.
What do you think it takes for people to make a shift in their health?
I believe people have to feel that they're worthy.
Do you think there's a social responsibility for these companies to actually make a change at that level?
I absolutely do. I think that playing off of the ignorance of the public is really something that's, saddens me and also confuses me.
How long do you think it'll take for things to change?
I think it's going to take a little time, but it's building. And I think it's building also because we have a lot to be concerned about.
In life, it's normal to have ups and downs. But what do we do when we get stuck? I've always been fascinated by the healing journey. Why do some people get better while others fail to make the shift? Welcome to the Expert Series, where you'll meet 25 of the world leaders in health and wellness, discussing their passions and what it takes to make your shift.
There's an electrical feeling in the room.
I had to be a mom. It was so important to me.
I've always been a pain in the butt, and I love that.
I knew that I wanted to help people.
I'm Katherine Maslen, and this is The Shift. In this episode, we have Dr Aly Cohen. Dr Aly is an integrative rheumatologist and environmental health specialist from New Jersey. She practices evidence-based rheumatology, lifestyle medicine, and complementary and alternative health options to support patients to heal from conditions like arthritis, gout, fibromyalgia, sciatica, Lyme disease, and autoimmune conditions. Dr Aly is one of the few integrative rheumatologists in the world, as well as being the co-author of the textbook Integrative Environmental Medicine, and author of the soon-to-be-released book The Smart Human, an essential guide to living healthy in a chemical world. She is the founder of the Smart Human platform, a speaker, and will soon be gracing the stage to do her very first TEDx talk. The field of environmental toxicity is one that is both terrifying and incredibly important for us to know about. Dr Aly is a leader in this field and adds a clear and reasonable voice to the conversation about our environment, the toxins we're exposed to, and the change we need to make to turn this around. Listen out for the connection between our gut health and conditions like arthritis and autoimmune disease, what's really in our drinking water, and the link between your plastic water bottle and your hormones. Hold on tight, this one has a lot of confronting information, so take your time with it and know that I'm here to help you shift. First up, I get Dr Aly to introduce herself.
My name is Aly Cohen. I'm a trained integrative medicine and rheumatology physician, as well as an environmental health specialist. Day to day, I try to keep my children alive, my pets alive, and plants. And then I basically try to go to work and I see patients clinically for, several days during the week. And then I'm also doing quite a bit of writing, lecturing, traveling to talk about some of the work that I do. So I have two children, two boys, ages 10 and almost 12, and they keep me incredibly busy. And we live on a farm in New Jersey, and my husband's a physician as well. So we have quite a conversation at dinner. Poor kids, just a lovely little family, but they keep me very busy and tired.
What made you decide to go into medicine?
I was preordained to be a doctor from a very young age. So my dad's a physician and pretty much everyone in my household is a physician. And so that was kind of in second grade, I was doing reports on the heart. So I started to like the attention from the idea of becoming a doctor because I was getting the attention. And I sort of began, moving in that direction. I was also on the stage a lot as a kid. So what's funny is full circle, I'm now doing a lot of stage work. And I think that having not made it in Broadway or anything on screen has really, I've learned to really appreciate where I am now with having an audience for this topic as opposed to anything else.
Now, you're a rheumatologist as well. How did that come about?
I think probably a combination of circumstances. I was a resident in training for internal medicine, which is required before any of the specialty training in terms of either cardiology or pulmonology, kidney specialty, even rheumatology. And there was a merger of two hospital systems at the time when there was only 2 or 3 openings.
So tell me, what is a rheumatologist?
So a rheumatologist, rheuma comes from basically the energy through joints. And so it's really a field that began out of joint-related diseases or joint issues. And we think of arthritis like osteoarthritis, rheumatoid arthritis. But it has since, expanded, of course, to infectious arthritis, such as Lyme disease, to crystal arthropathy or crystal arthritis like gout, pseudogout. It's gotten into areas where blood vessels are inflamed, so vasculitis and all of the different types of childhood and adult vasculitis, and also just very mild to moderate muscle strains. So it's really encompassed quite a few different areas with crossovers in other fields as well.
So what led you to then go into some other fields and look at other things outside of that?
I think I was finding through conventional rheumatology that it just wasn't enough for me, and that handing out medications, pushing people into drug trials, because they're often offered at doctors' offices. I think it just turned out to be not enough for me, and I felt that I was trying to find extra minutes to discuss nutrition or diet or even some stress or talk about someone's life, and finding that 15 minutes was only allotted for the time necessary for medication discussion. As I really became frustrated with that model, even though I was making plenty of money, and I try to share that with people that, money doesn't always bring happiness, and at least that's what I went through at that time. I knew that I needed something more, and I had wasted years of my life to be at this point and not be happy. And so I knew I had to either find extra education, figure out a way to implement what I really believed to be true into a conventional Western model and integrate the two. And that's how that kind of was born. I started just with exploring on my own, just kind of learning on my own time about nutrition and diet and whatever I could gather. And we came across a scholarship for rheumatologists, and there's only one, I believe at the time, was given per year, and I applied and I did receive it. And I was able to get 2 years of training under my belt from the best of the best, including Dr. Andrew Weil, Dr. Torona Lodog, and Dr. Victoria Mazes, and a bunch of other physicians that really set the path for this kind of training and access by most physicians who apply if they can get into it.
So what did you discover once you started studying that side of medicine?
I realized how deficient we are in our medical training. I think that was the most shocking. We spent a week studying vitamin A and a week studying vitamin D and a week studying vitamin B12. Or it was really shocking to see how so much of either our health and well-being or our demise comes from nutritional deficiencies, and even due to medications, and how medications can lower those, and cause depletion of nutrients. And really just opened my eyes to acupuncture and its history of healing and Ayurvedic medicine, and, just kind of giving perspectives of around the world of where healing takes place, but has been and continues to thrive and has efficacy.
Do you think that diet plays a role in arthritis development?
So it depends on the type of arthritis. There are over 120 types of arthritis. There are types of arthritis that, as I mentioned, are dietary. Let's use gout as an example. Gout is a kind of a remnant or an ancestral remnant of anthropology and evolution, where we as humans have a very difficult time breaking down large loads of proteins, particularly purines. And because of the way our food industry has changed with high fructose corn syrup in our diet, and certainly high loads of protein, especially people who are going for these high protein, low carb diets, I see 16-year-olds with gout, and normally you see them in 80-year-olds, right? Because they're overloading their body with protein powders and protein shakes and protein bars, and then their body can't handle that load. And we, as through evolution, have lost the ability to break down that amount. That would be an arthritis that can be certainly managed through nutrition, through diet, and is a type of arthritis, which is one of 120.
Want to look deeper into your own health? Our virtual naturopathic team help people from all over the world to shift their health and their life. We offer a 90-minute online discovery and diagnostic session where you can find out where you're at, why you're here, and what you need to do about it. Everyone is so unique, and sometimes it can help to have someone break down your journey and see where it is that you need to head next. To find out more, go to theshiftclinic.com and click on Shift with Us.
What role does gut health have in all of this for you in your practice and the type of patients that you see?
So gut health is becoming one of the key issues in human health in general. But when it comes to rheumatology, it's very key to understand that how the gut plays out into different types of arthritis is really quite remarkable. As I mentioned with gout as the example, we now know that, foods that are laden with these chemicals, whether they're fat substitutes or sugar substitutes, can have an effect actually on the gut microbiome. Synthetic sweeteners, getting into my environmental health aspect, these synthetic sweeteners can often break down into formaldehyde and other byproducts that are very harmful to the bacteria that live and should thrive in our 20 feet of bowel. So we really need to think about the food quality, but also the food content and chemicals, and then how the gut being not as, strong, for instance, or, it becomes permeable and leaky, so to speak, keeping the gut, hardy and strong and those bacteria thriving really does play a major role in the immune system.
Why do you think mainstream medical hasn't really picked up on this yet?
Well, I'll speak from a point of, I'll say that I was sort of one of them, and now I'm not. And the learning curve is quite steep. It took me a good 7 years, and I'm still learning as I go on this area. I also think it causes a great deal of stress because it shows someone how much more they have to learn. And most doctors feel that they've learned what they needed to know to get the degree. I think that it's something that has to be worked into younger training, residency, medical schools. High schools. And I think once you start educating at those levels, which is part of what my work is actually, I think you set people up for, greater ability to learn later on those topics.
Absolutely. Tell me, what are you doing in education?
Several years back, I was working with Dr. Andrew Weil in training, and he has a series called the Weil Academic Series, WEIL Academic Series, which is a series of textbooks that are very easy to read, but certainly require some degree of, science background, and were written originally, I think, for physicians and healthcare providers. And I said to him, I really think you should write, or we should have the textbook on an integrative environmental medicine. It had not been written. And he said, well, you do it. Find a researcher to partner with and see what you can do. And so after a good year of searching, I really found probably the finest person in research in this area to partner with, and created the Integrative Environmental Medicine textbook with an outline that I felt was the story. And the story really is, what's the problem? Give us the details. What's the problem? Why is it an issue? And then what to do about it. And it became my mission to collect with my partner all of the people who could not just tell the story on environmental contamination with water or in plastics or with personal care products or cookware, but food additives and all of the regulation and legislation failures, but to also give the what to do and how can we reduce these exposures and also reduce the risk of developing chronic health issues from these exposures. And so that has taken off as my areas, the what to do, to reduce those exposures.
Let's talk a little bit about some of these exposures and things that we're exposed to. And I think when I left for the US, at home, I've got my little routine. Yeah, I've got the products I use, the environments that I'm in. And I would say that within 3 days of being here, I was exposed to 1,000 chemicals that I just hadn't been previously. And that's everything from, the scents that they use in hotels. This morning I was at the gym downstairs and I was waiting for the lift, and a guy came past with a spray can of deodorizing perfume spray and was just spraying it all over the place. And these are the things we're exposed to every single day. Tell me a bit about that.
So it's interesting you say that, because it harkened back to some recent travel where we came from South Africa, and you're sitting on the plane and all of a sudden, two people are walking down the aisle spraying pesticide, essentially a pesticide for malaria prophylaxis. And, I had to sneak, a question to one of them to say, can you get me the contents of that bottle? Can you see? And no, they collect the bottles at the end, and it's very hard to get that information. So, what I realized is, unless I wanted to not, fly home and had to walk from South Africa. I really had no choice. And I think it goes back to this whole issue of what can we control and what can't we control? Because I think that when we focus on what we can't control, it's very frustrating and it makes us all throw up our hands and kind of say, give up. I think we should focus on what we can change, because it is remarkable the studies that are out there. For instance, young, Latino women who were given, 100 of them actually in this one study by the, it's called the Hermosa study. They were given personal care products that were healthier over a course of 3 days, and their urinary and blood metabolites of those chemicals that are considered harmful dropped dramatically over a 3-day course of just switching products. And I can give many, many studies where even reducing the use of canned foods reduces urinary bisphenol A by over 1,000% in one study. So the idea is that I think when we present the problem, and it is pervasive and it is a little overwhelming, we also want to present, or at least I feel that presenting what to do about it and why is really, really important so that people can feel that they can own this problem and make a real difference. I say start with your home, start with your workplace, start with the products you buy. What you bring into your home makes a huge difference. What you avoid altogether is cheap and easy. You just don't buy them. So there's just got to be guidance and good vetted resources.
Is there anything that you've come across linking these chemicals to gut health or microbiome health?
Absolutely. So the chemicals that we drink, the food chemicals that we eat, are in the thousands. I think we can really clearly start with that area alone. Particularly, again, processed foods carry hundreds and enormous amount of chemicals that have not necessarily been tested for safety, particularly in pregnant women as well as young children, immunocompromised folks. There's a whole bunch of chemicals for crunch, preservatives for shelf life, flavoring can be a number of chemicals. So even consistency. And when it comes to drinking water, which is actually one of my bigger issues, if you had to break any of these down, there's so many, clean drinking water, I think, is remarkably undervalued in even modern Western societies. I mean, I understand there's going to be problems with getting just any water in many countries around the world. But when we're talking sort of big cities, big, suburbs with municipal tap water, which have treatment plants in this country, there's 160,000 of them. We still have very little oversight. 91 chemicals are actually monitored, regulated, and adjusted in this country, and that's it. That's under the Safe Drinking Water Act of 1976. So we really do have a problem where only 91 chemicals are all that is filtered out at a municipal tap center and treatment plant, and then really you're left with all the thousands of others that can get into your drinking water. So those can actually change the bacteria species, quality, diversity. And so we know that that's a contributor.
So, water out of a tap is a modern miracle, and chlorine is essential for that to happen, but it does have an impact on our microbiome. Can you tell me a little bit about that and why people need to be filtering this out of their water?
Yes, and especially, I think coming from someone who takes it for granted that we don't have parasites on a regular basis from our water, and I do acknowledge that. But we do have, as you mentioned, required means of cleaning water, disinfectant, detergents that come from these municipal tap treatment plants, which are required, chlorine, chlorinated byproducts that come from the breakdown of those chemicals as well, are allowable, and detergents are allowable up to a certain level based on, drinking of an average adult male drinking 2 liters of water a day. What we're finding is that those chemicals can, as they're pesticides, they are killing also the bacteria in our gut as well, which are bugs. And we need to think about how to clean the water that we ingest to get rid of some of those chemicals before they hit our glass.
What other chemicals are there besides chlorine in drinking water that people might not be aware of?
Sure. Well, I'm going to throw a bunch of chemicals out, but we certainly have perchlorate, nitrate from fertilizers and farming areas, thiocyanate. We have bisphenol A, which is often in canned foods and canned drinks. We also have medications. We all actually take a lot of medications, as we know as a culture. And when we urinate, those chemicals, those medications will break down, end up getting into our wastewater, which may actually and likely does become drinking water eventually. So we have this recirculation of a lot of chemicals that people aren't really thinking about. what we want to really think about is how do we filter out as many chemicals as possible, because we're not all toxicologists and we're not going to always read our water reports monthly, although we should. I think the best way is to control the water cleanliness at the point of use, which is in our kitchen and does not require a whole costly setup. It can be very, very reasonable and very high quality.
Can you tell me a little bit about some of the more specific food chemicals that people might be consuming and how they're impacting on gut?
Sure. So, many people, as I'll use the bisphenol A example, and that was, by the way, a lot of the work was done by Dr. Frederick von Saal, my co-author and co-editor for that textbook. So he was really remarkable, and him and his colleagues in discussing how bisphenol A is one of the many endocrine disrupting chemicals. So there's a class of chemicals that we know affects human hormones. And those human hormones range from thyroid hormone, affecting thyroid receptors in the gland of the neck, the thyroid gland, and also breast tissue, where we have receptors. That's also, low levels of estrogen and androgens such as testosterone, and how these chemicals can disrupt the normal workings of those very sensitive chemicals in our body. So we know that bisphenol A has become sort of the most tested, most well understood of the endocrine disrupting chemicals. It's also one of the most pervasive chemicals that we experience as humans in our country, but also around the world. It's not just in canned foods, but it's in baby toys, although many have that has been phased out of many of the modern American allowable toys in this country. It doesn't discount all of the toys that may come from overseas, all of the different utensils that we have in our cookware that comes from overseas. Also a group of chemicals called phthalates. And phthalates have hundreds of different chemical structures, and there's many different kinds, but DEHP tends to be the one that's most studied, so that there's a common language internationally on what people are studying and how to discuss those findings. Phthalates are used technically to make plastic soft, where in general, bisphenol A has been used to make plastics hard. And so when you think of phthalates, for instance, you think of maybe nail polish, where you have this kind of plasticky chemical, but you want it soft enough to not chip. Or think about vinyl shower curtains, or things that are making plastics soft, even, phone cases. And these chemicals are known to affect everything from childhood development in utero, sex differentiation and orientation as an infant, male genital formation, believe it or not. And we now know that drop testes, which is called cryptochidism or chidism, depending on how you pronounce it, is very commonly related to chemicals like bisphenol A and phthalates. And phthalates are also found in perfumes, any kind of fragrance, because their job, similar to kind of maintaining a structure of plastic, it's to maintain the odor or the fragrance of a product. So it gives a smell longevity, shelf life. So some of the fanciest, most expensive perfumes that we can buy at the perfume counter actually are laden with phthalates by definition.
So one of the dichotomies that I see, and I don't know if you get this in Australia, but we have personal care brands like Dove is one of them that's done it before, where they'll have a breast cancer campaign. So everything's pink and they're donating, but then they're selling deodorants that have fragrances in them, which are known to be associated with breast cancer risk. Do you think there's a social responsibility for these companies to actually make a change at that level?
I absolutely do. I think that playing off of the ignorance of the public is really something that's saddens me and also confuses me, because if the true philosophy of a company is to really do good, then it's upon them to really search out the best way to do that. We now know that there are plenty of opportunities in organizations that manage these type of issues. When it comes to problems, we just saw the Johnson & Johnson issues with talc and baby powder. So, I think we're finding, and Monsanto with, in terms of glyphosate, with the gentleman who just got awarded, huge sums of money because of his exposure to glyphosate, which is, what we know of as Roundup in this country as a weed killer. And again, this goes back to the work I'm doing with teenagers, that when you start educating, that reduces chaos. And there's also groups like the Environmental Working Group, run by Ken Cook and his team, that do a remarkable job of, really bringing to the forefront legislatively as well as to the consumer, what is considered harmful.
How important do you think eating organic food is?
As much as I'm very supportive of the organic movement, and I am, because we know organics in this country, basically the label of organic in this country, in the U.S., is the only thing that really has teeth. which means that it actually has criteria. It was started in 2002, and we have all levels of organic. So we have, for instance, in the food industry, we have either it's organic or not. But in the personal care area, we can have organic ingredients, but also a lot of other junk in the same product. So it's not as overseen as well. It's used as marketing tools more than anything. But in the food industry, organic really does have teeth, and it's pretty much the only thing that has teeth in this country. And what it really means is that it has to abide by certain rules. They have to be certified and monitored by government regulators to drop in at any time to make sure that they're following procedure. If it doesn't have the USDA organic label, then it's very questionable. All natural does not mean very much, if at all. So we have to really think about some of the marketing terms that have kind of squeezed by. But what's interesting is that there's, over the years, there's been some argument or, discourse over whether organic is healthier. We have to decide what you want in terms of health. When it comes to the nutrient value, that can be variable, even amongst organic produce, organics products. But when it comes to chemical exposure from fertilizers that are harmful and from the pesticides used to farm and grow those ingredients, there's absolutely a difference.
How we feel colours our days. If we're emotional, anxious, low, or have low self-esteem, it severely impacts on our lives. In Season 2 of The Shift, we'll explore our minds, the neurochemistry, the biology, the emotions, and the subconscious. You don't want to miss this, so be sure to subscribe so that you know when it drops.
The Shift!
Tell me about the smart human.
Sure, I'd love to. I happen to be really proud of it. Out of, I think, really just frustration of understanding the playing field of environmental chemicals in this country and such a lack of regulation in terms of, we haven't had any good legislation passed since '76, the Toxic Substance Control Act. Essentially, we have no requirements for testing of almost any commercial or industrial chemical before it goes to market or goes into the products that go to market. And it leaves us really with this uncertainty as to whether or not anything is really causing us harm. And that's even if it's on your radar that there's a problem. And so out of frustration, I started to think about, some of the books that were on the market already, Dummy's Guide and Idiot's Guides. And I thought, well, boy, that's a little bit makes me feel bad about myself when I want to look up something. So I thought about the smart human for several reasons. The smart human I named because I want people to be empowered to be the smart human, to make smart choices, to feel empowered, and to have no regret, but to move forward. And I wanted it to be human because I think it also equalizes all of us. We are all human, no matter what your culture, your religion, your traditions, what you wear, what your skin color is, what your age is. So I started that a few years back, and my whole intention was really to get this information to people, everyday people. And it also came from my frustration of the medical system, where I had been, as I mentioned, running around to grand rounds lectures at some wonderfully large and impressive health institutions, and realizing that not really much of a response was coming from it, from the physicians. And not only that, not even feeling that they were conveying some of this information to their patients. They were making changes to their families, which I heard from. But then I would say, did you actually implement this to your pediatrician, your peds patients as a pediatrician? And no, of course not. So I created the Smart Human as a platform, an education platform to reach everyday people, every age group, even down to, fourth graders. And the point being is that if the message is given in a nugget, in a very simple, well-framed message, along with a great article that supports the message in case people want to dive deeper, but has the bullets of what to know and what to do about it, that even busy people on the go would be able to get some really good, healthy information to decide if that's good for them or not, for their families and what have you. So that was my attempt to reach people outside of just conventional medical institutions and doctor-patient relationships.
Can you think of a time when you've made a really big shift in your life, and what did that look like for you?
I think that the water issue, when we first moved, I like to talk about water because I'm always surprised at how kind of mad at myself on some level I am for not having paid attention to this for most of my life. And you cannot get mad, and you can only go forward. Back in the day when I certainly did not care about health or wellness, and I was drinking Diet Dr. Pepper maybe 3 or 4 times a day and Oreos, and we moved to this place and we thought, hey, you know what, let's put in a filter. just because we don't know if there's any breaks in the piping from the municipal tap. Really, the filtration should take place in the home and can be under $300 for a good, for instance, reverse osmotic water filter, or even a carbon block filter, which is the pitchers or the sink filters. But any type of filtration is worthy. And I think we switched over, when I just got married, before I even had kids. And it was the one thing that I now look back and very pleased at myself for, but it wasn't even for the right reasons. But it's one of those things that I'm happy at this point that I did. And now it's become really one of the things I talk about most, particularly with teenagers and different audiences, because like I said, it's not hard to correct, it's not hard to fix, but people have to buy into it and feel that it's worthy, and they're worthy of clean water.
Can you think of a patient story where gut involvement was really something that you noticed that was important for them?
Yes, I think a lot of patients who come to me, no matter whether they're perfectly well and have no real medical complaints, all the way to, really sick people, one of the first things I always start patients thinking about and convincing them about is this whole gut microbiome topic, which a lot of people have never even heard of before. And I often give out some very good New York Times articles that I think are beautifully written. What I try to get people to think about is, I think starting with a good, removing some of the horrible foods or some of the things that may be contributing to any kind of gut-related symptoms is number one. Of course, talking to them about water is something I talk to, is a big issue. And then discussing the idea of probiotic foods, prebiotic foods, and even taking a supplement for probiotic, which is not always first on the list, again, because of cost and availability. It's more about behavior changes and food choice. So, I start with that topic very early, perhaps even the first topic I come up with when I talk with patients, because I want to lay the foundation of how important the gut is to pretty much all health and prevention.
So speaking to all these different doctors that I'm interviewing for the shift, and they're all integrative, so they've all kind of adopted this other side of things. And it's a really common theme is that when I asked them what it was like, when they realized that things weren't really wrong, it was this disappointment or this anger or this frustration just with the system, and it not being okay. And I do think this is a systemic problem, that it needs to come, as you said, like from kids, from education, through universities to actually really make the change. How long do you think it'll take for things to change?
I think it's going to take a little time, but it's building. And I think it's building also because we have a lot to be concerned about. Climate change, which is a whole nother topic for another day, really does play a key role in the environment and how that plays with environmental chemicals. So, we have to really think that time is of issue, and people are getting sicker. They're living longer, but they're living sicker. And I think that's a real important issue.
Can you tell me a little bit more about cell phone radiation or mobile phone radiation? Because it's one of those things that when you talk about it, you get a bit of an eye roll. Yeah, like it's a bit crazy, or it's seen as a little bit kind of conspiracy theorist, I guess. Tell me what's involved there.
Yeah, so, I absolutely agree. And if I were to tell my kids I'm taking away their phones, they would literally, kick me out of the house. It's really saying, look, technology is not going anywhere. I'd be a hypocrite to say I don't use my phone all the time. But what I try to do is reduce that risk in every way possible that I can, which takes little to no additional effort. For instance, in our household, we turn off Wi-Fi at night. We even take out the little Wi-Fi enhancers that you can put in plugs to kind of get the signal all the way up to the third floor of the house, for instance. We can pop those out. We can turn off the button because there's no real conceivable reason to be sleeping when Wi-Fi is on. There's just no reason for it. The other thing is we turn on airplane mode so that we can still hear our alarm, and yet we don't get text messaging. We don't get cellular radiation to the area around our heads, which is usually our nightstand. It's basically a transistor radio, and we are having signal pinging and ponging between a cell phone tower, any whichwhere, that's closest, and your phone, which is actually an antenna. And so if we were to actually sprinkle pixie dust all over the radiation rays, I think people would be horrified to see how much radiation is coming into their sphere of their living. And so it's just a matter that we can't see it, we can't feel it, like so many other aspects of environmental health exposure, but when we know it, we can work with it. And, you can download kids' games onto phones and tablets so that it's on the memory and you can then turn off cellular. My kids do that all the time. We do not let the kids leave any technology in and around their groin area, put it in their pockets. We don't let them sit with anything on their groin. They are on a table setting. And so it's just these little bit of nuances I think are very, very important.
It's that whole thing of, when you can't see it, it's not a problem. Yeah, it's this kind of cumulative thing over time. It's not like you spray on a little bit of perfume and straight away it disrupts your endocrine system, arguably, but not in a large scale. So can you tell me a little bit about the challenges with research to actually prove that these things are harmful for our health?
Yeah, excellent question. So, we know that really whether or not you develop a disease or an illness really depends on several things. It's not just an exposure and how long or what that exposure is. That's one aspect. But it's also your lifestyle and it's also your genetics. There's really this dance between your genetic makeup, your lifestyle, which includes diet, exercise, stress, childhood trauma, all the way through to exposures. So, not every one of us is going to, wake up with a disease and may have had the same exposure to the same fertilizer out back in their yard or what have you. But the idea is that we know through animal testing and human studies now, we really do know. We have enough information. The World Health Organization does a report that is literally 4 inches thick on endocrine disrupting chemicals. I think that that's just a really important thing to know, is that there is consensus amongst major bodies in the medical world and among bench researchers and major health institutions, and that we have to think about the fact that causation is not always the same as association. We don't always have a cause and effect, but using this precautionary principle, which we're using, which basically says even if the evidence is not there, that if it can reduce harm and it can likely cause harm, then we should stop that behavior or that exposure. That's called the precautionary principle, which is really used worldwide at this point.
Yeah, so prevention. Coming back to at the start of the conversation, what you said about that there's all these different chemicals, but there's no process of saying, hey, is this safe first? It's like, well, let's just put this into the market and then see what the consequences are 10 or 15 years later. What do you think needs to change legislation-wise so that we're protected from these new chemicals?
Well, I think what's going on amongst the people that do this best, which is, advocacy groups and the people who are fighting the good fight on Capitol Hill, is that there's so many different areas, but one of the top ones is really to make sure that these chemicals are tested in a reasonable way by the appropriate people, not just industry people and manufacturers who voluntarily give some information to the public, and to the government, but really done correctly. And we have a very good infrastructure to do so. It's changing. We now have over 42 million pounds of synthetic chemicals that come into the country every day. We have 1,000 new chemicals at least every year that are coming onto the market. There are 15 new patents per week in this country of new chemicals that are not undergoing any testing for neurotoxicity, developmental risk in pregnancy, cognitive development in children, any of these parameters. And only 5 chemicals in the United States has ever been taken off the market since 1976. In Europe, we have over 1,100 chemicals that have been taken off the market or not allowed to be used. But in this country, only 5. And I think that's pretty remarkable, these numbers.
This is the thing. It's not any one chemical, often it's this sort of conglomeration.
It's very interesting. And on the other end of things, we're seeing young girls going through, their menstruation is starting, many, years earlier than it did decades ago. Even 2 decades ago, it used to be that women, young girls got their periods at the ages of 15 and 16, and now we're as low as 8, 9, and 10. And that's a real risk for breast cancer from estrogen exposure over a lifetime. So, you're seeing at different, ends of the spectrum of development that these endocrine chemicals can really have a whole host of effects. And so that has to be brought out, to the public.
Scary, isn't it? I know in our clinic, we do an environmental toxins workshop, and it's a little bit morbid, like it's a little bit depressing, and it can be a little bit doom and gloom, but it's just looking at for people, most of these things they can remove if they can work on the biggest things and just try and do what they can and what they can control. Is there any interesting research you've come across recently that you want to share?
There was a paper not long ago that talked about the microbiome of breast tissue, which I thought was very interesting. We have microbiomes everywhere. I used to think it was just the gut, but we actually have a lung microbiome and a brain microbiome and skin microbiome, which a lot of actually, dermatology people are trying to market. But we also have this skin area around the breast, and there was some research done as to whether or not breast cancer can be reduced just from breastfeeding. That has not as much, or I should say not as much, but is in addition to the benefits of breastfeeding in and of itself, had a lot to do with the exchange of the microbiome between the baby and the mother from the skin microbes. And I thought that was pretty fascinating.
That is so fascinating too. Tell me, what are you working on right now?
So I'm working on the consumer version of the textbook Integrative Environmental Medicine, which is on Amazon. But it's going to be the consumer version, which means it's going to be a little bit easier to digest for the average person. It's going to be filled with great information, but also great practical information as what to do, what to change out, what to think about. And then also I'm continuing to fight through the system and try to get environmental health and prevention curriculum into or available to all schools across the country, public or private, and maybe even internationally, because I think these topics are, international and cross, and have no boundaries. And so that will be, I hope, the legacy that I can give is really giving something back that is lasting. So that would be my goal.
Great. Oh, that's awesome. Well done. So tell me about BPA and some of these toxins, and tell me about some of the things that we can do to actually reduce our exposure or detox them or get rid of them.
One of the aspects of nutrition that I think people aren't aware of is that what you eat actually can, in many ways, protect us from these exposures that we can't always control, right? So believe it or not, being nutrient sufficient, which I like to term, is the way to protect us.
And so many kids are iron deficient. It's one of the most common deficiencies as well, and they're so vulnerable at that age, aren't they? Looking at the role of food in gut health, that it's multifaceted. Like, it's not just about fiber, it's not just about all of that, but it's about the entire picture. What does a healthy gut diet look like to you?
I think we have to think about anthropology. And this also goes back to the name, the smart human. We've been evolving for over 2.5 to 4.5 million years. And, that's a pretty darn long time. And yet we've had exposures to not only, dairy and grains for 10,000 years, more or less, but we've really only been exposed to environmental chemicals for the last 200 years. Out of a 2.5 million year existence. So we have to think about anthropology when we think about where we are with this pickle we're in right now as human beings in modern day living. So the healthy gut, based on what we know about this anthropology, the anthropological history of human evolution, is that really we should be eating what our ancestors ate to some or most degree. For instance, we should be really having clean, fresh drinking water. We should be eating foods that have come off the vine as much as we can, or going to local farmers markets where the food was picked that morning, understanding whether or not there's exposure to pesticides and which ones, just by talking to our farmers and people who grow our food. Thinking about exercise and sunlight and community and spirituality and all of the things that make humans who they are, I think is really important, and it plays out into the gut. Remember, the gut also gets very acidic when we're stressed. So to just talk about food and drinking water and probiotics and prebiotics, we're also missing the gut-brain connection, which we know when we're stressed, we have more acid reflux, or acid, I should say, influx into the gut, and really that can wipe out a good portion of the good guys as well, when we change the acidity or make it too alkaline even. So we really want to think about sort of evening out not just the food and going back to our roots, nuts, berries, whole foods, whole grains, clean, fresh fish that's wild caught if possible, grass-fed beef if possible, no antibiotics in our food, in our poultry. But also think about other aspects that affect the gut, such as stress, such as anxiety, such as sleep, which is really important to reducing exposures to chemicals as well.
So one of the really interesting things that I'm thinking about, and as a naturopath, we always look at everything's connected. Can you tell me a little bit about the effect of environmental toxins and drugs and how they're metabolized in the body?
what we're learning about in personalized medicine, because that's really what this is coming down to, is how does one individual and their life and actually how their medications even work on them, for them, with them is really, really kind of important. And of course, that depends on sort of the milieu of their gut, of whether or not they have the right microbes and the right diversity without the right stress or wrong stress, I should say. We want to think about in terms even of my medications for patients. So bringing it to the clinical and the practical world, a lot of the medications that I do use, I try to avoid the gut. I use subcutaneous versions. I use sublingual versions, because if the medicine has to go through 20 feet of bowel, and everyone absorbs differently based on their lifestyle or stress or competing medications or competing chemicals in their system for any reason, then they're not necessarily going to get the benefit of that drug as effectively as someone else. And in addition, they may have to use more of that medication as opposed to being more efficacious by doing a subcutaneous shot where it goes right into the system. So I use that, for instance, methotrexate is a drug that I use quite a bit with my rheumatoid arthritis patients, among others. And I try to avoid pills altogether. And that's the conventional way to use it, right? No one really wants to give themselves a shot. But if you can use less medication as an injection, as compared to an additional pill or two to get it absorbed to have the same reaction, I'd rather use the shot.
Tell me, how did you get into environmental medicine?
So it's kind of a sad story, but it's kind of a happy ending in a way. So about 8 or 9 years ago, I had a beautiful golden retriever. I mean, gorgeous golden retriever, and he was technically my firstborn because we had him before our children. And about 4.5 years into his life, he became really sick, and we thought he had just swallowed a sock or something else. And he was jaundiced, and so he was going into liver failure. And so when we finally figured out what was wrong with him, it turned out that out of all things in the world, he had autoimmune hepatitis, which meant his body was attacking his liver. And when they diagnosed him at that time, he had literally a liver the size of a small apple. It was just way too small. And so he was really in bad shape. And we were heartbroken. And I spent, I would say, weeks trying to research what could have caused this dog to have not only a very unusual diagnosis for dogs, but even particularly because, our vet worked with us, for golden retrievers. It's just a really odd breed to even remotely have this diagnosis. So, I spent weeks researching, anything that could possibly have given him this diagnosis. His dog food, was it contaminated? Was it from China? Was it the pesticides that we live in and around in the town in New Jersey on the farm we live in? Could have been his drinking water. Could it have been, any exposure that he could have swallowed? And, we really never found a direct cause, except for the fact that he had been sucking and chewing on this one dog toy that was plastic. He had about 7 of them. Most dogs just play with their toys once in a while. This dog actually was chewing on it from 10 weeks old onward. It kept him from eating the siding off of our house. So he had a plastic toy. And we'll never know cause and effect because obviously, there's no great testing on dog toys. But we know that there may have been that exposure, knowing now what I know about plastics and plastic chemicals and endocrine disruption. But at the time, all I was finding out was lack of regulation in the U.S., personal care products and all of the chemicals. And so really the passing of that dog, the illness of that dog really kind of started me on my journey, because if I had not had this sick dog to be sad about, I would not have even explored what was going on in the markets for humans and consumers. And the more I learned, the more I started to get into the environmental health effects of humans.
How did you feel in that moment, like realizing that something like that could have killed your dog?
Well, it's one of those things where, you feel really, frustrated, but really just kind of shocked, that there's really not enough going on and at the time in terms of animal protection. I mean, here it was this animal that I thought and it was one of the most popular dog toys on the market. And we'll never gather data on whether that toy, even though it's one of the most popular in the market, there's no data on whether or not dogs are coming in with autoimmune hepatitis. No one's keeping records. And yet we might have this really big thing going on here. But I just felt, I felt like something was stolen from me, to be honest with you. And I felt that there should be more oversight, and we should be more aware as to what's really affecting our environment and how that really does play out into real life sadness. So that was a really big turning point. And that's actually how I got into environmental health. It was that. And every lecture I give, I actually put up his picture, because Truxton, his name is Truxton, was really, everything's dedicated to this dog and what came of his sad death.
So Truxton has a legacy.
He has a legacy. He certainly does.
Tell me, what do you think it takes for people to make a shift in their health?
I believe people have to feel that they're worthy. I think self-esteem plays a key role in any type of change. And I think when people feel, a lot of folks feel that they may not be as worthy as their children. I find that interesting. Most people clean up a lot of their behaviors when it comes to either getting pregnant or trying to get pregnant or even having young children. And so they definitely would think more about their children's health than their own. But I think we need to all think about what we are worthy of. And when you think on a self-esteem level, when we think that we're worthy, we're willing to make those changes because we feel that we deserve it. I also think people don't want to be judged. They don't want to be yelled at. They don't want to be told that they made mistakes. They don't want to feel regretful about their child's autism and what they may have or may not have contributed to that diagnosis, or their own breast cancer. So people really want to participate in their health, but they want to do it in a way that doesn't make them feel bad. And when we can meet people where they're at in terms of where they're ready to change, I think that's where the greatest success happens.
That's an excellent quote, I think, to finish on. But do you have anything else that you would like to add?
I wanted just to mention about some of the demographic, as I mentioned, the teenage group is really so critical to the work that I feel is important, having, lectured to older folks, to healthcare folks, to every kind of adult group you can think of. And what I found with my work with high school students and even elementary, but mostly high school students, was that they are really the most important demographic to reach with the topics that I'm dealing with. I think if we hit the teenage group, the high schools nationally, and we really give them an opportunity to learn about this information, we're setting them up for not just their own health, but the health of generations to come. Because many of these chemicals, believe it or not, actually have transgenerational health effects, where they affect the genome. Once someone is pregnant and you're exposed, you're actually exposing not only the fetus to those potential health issues from gene changes, but also the germ cells, which are, the fetal genitalia, which contain the eggs and sperm cells and the apparatus to do so. So you really are eventually helping the next generations years after, if, say, a teenager decides one day to have a family. But teenagers are unique. They're tech savvy. As we all know, my kids included, they are very body aware. They're very self-conscious, which is also a very good time to get this information into their hands to make the right changes. We talk about safe dating, and we talk about bullying, and we talk about all these things that affect our bodies. We really need to be thinking about what we put on our body, what we breathe into our body, what we use for, again, personal care products, feminine care products. And they're also one day going to vote. They're one day, as I mentioned, may have children, and they're also the demographic that uses the most personal care products of any. So we really should be thinking about them to move the consumer market in a healthier direction through just purchasing power. So I wanted to just bring back to that area, because I think, having done this for a little while, I now know where to put the efforts into. That's really going to be key in terms of making real lasting changes for our health.
I think that's really important. And I think that's something that not a lot of people are talking about is coming in at that teenage level. How do you think that we can reach these guys? Do you think it needs to come in at the school level, or do you think it has to be via the parents?
Well, I would love to say it's via the parents, but I think that that's like educating more people to educate more people. And I think it's a little bit of a hurdle. What I'd like to do, and what I've been working towards, is to build a curriculum that's available nationally and internationally, because we know this is an international problem, these endocrine disruptors, and to really think about, getting this in through the health and awareness, kind of body health curriculum. I mean, these are really important topics that once we sort of get it right at this age group, I think we're going to see a ripple effect of change. And they're the right population. So curriculum, education, having them aware of social media like the Smart Human, where they can get little nuggets of good information at reasonable periods so it's not overwhelming. I think that's really where it's going to have an effect and how we can get to them.
Is there anything else you want to add?
I just want to share that, if there are people who are interested in this topic and they want to kind of bite off a little bit, but not necessarily ready to jump in to swim, they can certainly learn a little bit here and there from the Smart Human. And again, it's not designed to be overwhelming. It's designed to be helpful and to give people information to make those choices for themselves. And so on Facebook, Twitter, Instagram is The Smart Human. The website, thesmarthuman.com, is loaded with articles and podcasts, radio shows, and all sorts of fun stuff. And, to make mention that it's really about the journey and to move forward empowered and not with regret, but to say, you know what, today's the first day of the rest of my life and I'm going to make this change and see how it goes. And I think that's all we can ask of ourselves.
I love that. Thank you so much.
There was so much amazing information in this episode, so let's make sure that we've gotten the key points and the actions that you can take as a result of this. When you begin to dig into the world of environmental toxicity, it can be very overwhelming and sometimes just downright depressing. But it's so important to know, so I'm going to break down what Dr. Cohen said here so that you can really get it, along with some very simple things that you can do to reduce your exposures today. Number 1, there are thousands of chemicals in our environment, and every day we have more and more being released to the market. These chemicals have little to no safety testing, and it's not often until years down the track that we identify that there are problems with them. It is therefore safer to just try and avoid man-made chemicals than to risk exposures if you don't have to. Number 2, drinking water is one of the most important things we need to look out for toxicity. We need to consider the chemicals added to the water, such as chlorine and fluoride, but also the contaminants that are found in waterways and groundwater from farming and industrial runoffs. Number 3, phthalates and bisphenol chemicals found in plastics and perfumes are endocrine disruptors and have been associated with increased cancer risk, cognitive impairment, hypertension, reproductive issues, and infertility, amongst other things. They disrupt the function of your endocrine system, and nearly all humans have been found to contain trace levels of these chemicals. Number 4, electronic radiation, such as that of Wi-Fi, is unavoidable. However, we need to do what we can to avoid it where we can. Switching off Wi-Fi at night is a very good example of this, and you could also put your phone on flight mode while you're sleeping. Number 5, definitive evidence for exposures on health can be hard to pin down. This is because small amounts of these chemicals cause disease slowly and in combination with one another over very long periods of time. The precautionary principle says that if there is a possible risk, we should avoid these substances until proven otherwise. A good example of this is glyphosate, which has mounting evidence of carcinogenicity, however, is still in a research process. Listen to episode 11 of The Shift to learn more about the story of glyphosate. If you'd like to delve deeper into this world of environmental toxicity, I'd recommend visiting the Environmental Working Group, or EWG.org, or checking out Dr. Cohen's community, The Smart Human. I also talk about environmental toxicity in my book, Get Well, Stay Well. Learning is great, but action is better. Here are a few of the things that you could do as a result of this conversation in order to help you shift your health and your life. Number 1, start with the products you buy. We vote with our wallets, and avoiding products with these harmful chemicals is the best thing for you and the planet. We're beginning to see the movement towards more natural products, and they're becoming more widely available. Look for products which are 100% natural based, free from synthetic chemicals and from fragrances. Number 2, get a good quality water filter. If you want our team to check out yours and make a recommendation, join our group at theshiftclinic.com/group and ask us. It's important that all types of water are filtered, including bore water because groundwater can be contaminated, and including rainwater because it can be contaminated with air pollution and things from your rooftop such as paint, mould, and animal feces. Number 3, avoid using plastics that come into contact with your food or drink. Use stainless steel or glass food containers over plastic ones. Avoid takeaway coffee cups which are lined with plastics. And please, please, please stop using K-cups or other plastic coffee pods. Some studies show that up to 55 times more BPA can be leached into your food and drink when it's heated. So having hot coffee out of plastic is a very bad idea. Canned food should also be avoided because it's lined with plastic. And always use a stainless steel or glass drinking bottle. Lastly, eat organic where you can. I know it can be hard to be perfect, but a good place to start is to check out the Dirty Dozen and the Clean 15, which can be found on the Environmental Working Group website. We'll provide a link in the show notes. I know that some of you will listen to this and feel like it's too much and that it's hopeless. What I can say is that if you are conscious about this, you can reduce your exposures by around 95%. So be positive in the fact that there's so much that you can do. Look out for Dr. Aly's new book called Non-Toxic, A Guide to Living Healthy in a Chemical World, which is due for release in early 2020. In the meantime, head to thesmarthuman.com or follow Dr. Aly at thesmarthuman on Facebook or Instagram. We'll provide links in the show notes to all of these resources for you. The next episode on The Shift is one of my absolute favourites, where we dive into the expertise of Dr. Leo Galland, a pioneer in integrative health. We talk all about allergies and even go into the story of Leo's son and his otherworldly experiences after his death. Make sure you subscribe so you don't miss a thing.
Coming up on The Shift.
Tell me about hidden allergies and the allergies that people have and the symptoms they can cause that they might not even know about.
These are mostly related to food and mold and chemicals.
Why is it with food allergies that sometimes people get symptoms and other times they don't?
So there is this interesting dose-response phenomenon with food allergies, and it's something called a masking phenomenon.
I want to talk a little bit about the Christopher journey.
Well, I had a son, Christopher, who died at the age of 22.
When we're trying to make a shift in our lives, all it can take is one small thing to set us in the right direction. Perhaps for someone you know, it could be listening to this podcast. My hope is to get this into as many ears as possible. So if you know somebody that's stuck and needs to make a shift, why not send them this podcast? It could be the one thing that sets them in the right direction.